the work that you've put into this. It's so appreciated.
I've never seen my picture on a poster before.
It's a beautiful picture. Beautiful.
I feel like a celebrity.
It's a keepsake.
Definitely look like a celebrity, ma'am.
And she very much is in our school, Professor Sheila. She is the most celebrated and valued.
Oh, thank you. Professor Sheila, I'm very shy, and it was a struggle to even find a picture of me because I don't get my picture taken very often. So
hope we did justice to that, ma'am.
I'm just, you look at yourself and you say, oh my goodness.
Ma'am, can we start? It's 5:30 here, and we are expecting some more students to join. They've just left for the day, and maybe they will freshen up and they will join. We are recording this webinar, and we are also live streaming it on our YouTube so that it could be reached to a wider student population.
Thank you. So should I go ahead?
Just a minute, ma'am.
Okay.
So an examination is that one factor that every student has to go through in their lives. Exams are excellent tools to assess what pupils have learned. Exams improve the students' overall personality, memory, and their revision skills. But it is never liked by students as it is very stressful. So exam stress is normal and very common. Students must master themselves to cope with this examination stress. So without further ado, I would like to introduce our speaker of today's webinar, Ms. Dawn Lanfair, a registered nurse, and she is a longtime faculty member at the Center of Nursing Studies, the largest of the 3 nursing schools in the province of Newfoundland and Labrador, Canada. Ms. Lanfair has a registered nursing diploma from the Salvation Army Grace General Hospital School for Nursing and holds Bachelor of Nursing and Master of Educational Psychology degree from Memorial University. She has nearly 34 years of experience in nursing education, having taught at the diploma and baccalaureate levels. Ms. Lanfair is a strong supporter of lifelong learning, having completed numerous webinars and sources related to topics such as nurse licensure examinations, palliative care, grief counseling, suicide intervention, and indigenous health. She has also completed Healing Touch training and is a certified Healing Touch apprentice. She is actively involved in several academic, professional, and nursing regulatory committees. She has been in the role of guidance counselor at the CNS since 2004 and continues to be an outstanding supporter for nursing students. As a guidance counselor, she provides personal, academic, and career counseling to students in all nursing programs offered by CNS. We are very privileged to have such an eminent personality amongst us. So we are eagerly waiting to hear from you, ma'am. Over to you, ma'am.
Thank you very much, Professor Sheila, and hello to everybody. Can you all hear me? Oh, Sheila, am I loud enough? Is this working? You can hear me okay?
I can hear you fine, Dawn.
Okay. All right. So Professor Sheila is going to put the slides up and that I've sent her. We're going to go through some slides as we talk this morning about the topic, which is beating the exam blues, exam success strategies for nursing students. And as Professor Sheila said, I've had the privilege of working here at the Center for Nursing Studies with students in our practical nursing, our baccalaureate program, and our continuing studies program. And it really is a privilege for me to be able to do this. This is one of the reasons that I feel that I'm contributing to the world in a positive way. And I bring this forward now because thinking about your purpose as a student nurse and your why you want to do this is going to be very important to support you as you go through those rocky times in your programs, maybe times when you're tired or you feel overwhelmed and you're wondering if you can do this and you're starting to doubt yourself. So really sort of taking a moment and connecting with what brought you to nursing school. What was it that you wanted to accomplish? That's going to be an important grounding point as you go through all of your nursing school and as you go through your career as a nurse. So I really encourage everyone to when you're feeling stuck or when you're feeling overwhelmed or when you're wondering if you have the energy to do this, to focus on that. So the topic today is going to be beating the exam blues, exam success strategies. And I'm just going to touch on these things because this is, we have a short amount of time, but I'm open. If you have questions, I guess you could put them in the chat and Professor Sheila can let me know. And if I can respond to them, I will do that. Next slide, please. So Dr. Watkins, my director, is here with us today, and Dr. Watkins and I are both here in St. John's, Newfoundland. And so we would like to have an acknowledgement of our land and the territories here in Newfoundland, as we do at the beginning of most of our presentations. We respectfully acknowledge the territory in which we gather as the ancestral homelands of the Beothuk, and the island of Newfoundland as the ancestral homelands of the Mi'kmaq and the Beothuk. We would also like to recognize the Inuit of Nunatsiavut and Nunatsiavut and the Innu of Nitassinan and their ancestors as the original people of Labrador. We strive for respectful relationships with all peoples of this province as we search for collective healing and true reconciliation and honor this beautiful land together. So today, I really thought that I would try and organize the things I'm going to present in some type of a model. And so I chose a model called the CAT model of test success. And you'll see a picture there on this slide. This is my little cat named Zeus. And I'm looking at Dr. Watkins smiling. Dr. Watkins is a real cat person, and she does a lot of work with rescuing cats and taking care of cats. So this is Zeus, and I introduce you to Zeus today because Zeus has demonstrated to me over the many years that I've had him many strategies that have helped him to become competent. He's a working cat. We rescued him with a job in mind. And his core competencies were to take care of I live in the woods, and so there are a lot of mice and rodents around my home. And so his job was to keep those mice in the woods and not allow them to come into our house. And so we're going to be thinking about him a little bit as we move through the slides today, because he demonstrates many of the skills and uses many of the strategies that I will be talking about in this model of test success. So this CAT model of test success has 3 categories. The first being comprehension or understanding. You really need to have a deep comprehension of the content that you are going to be tested on in order to succeed or to do as well as, meet your potential when you're writing tests and exams. You also need to have a very clear understanding, comprehension of what your exam is going to look like. And you need to have a deep level of comprehension and understanding of yourself, you as the individual. And we're going to talk especially a lot about the self now in a moment. So understanding the things that you are going to be tested on helps you to, of course, to be able to set up your review and to set up your schedule before you, so that you can know where your strengths and weaknesses are. So where did you do well in your program? What areas were you strong in? What were your areas of weakness or your gaps? I recommend when you're reviewing for any type of high stakes exam or end of season exams or end of the year exams, to really start with your gaps first as you're studying and reviewing, because that's going to take the most energy and the most time. So in the CAT model, you must have a level of comprehension about what it is you're being tested on, how you will be tested, and about yourself. You also have to learn how to deal with anxiety. And Professor Sheila mentioned this in her introductory comments. The research and the lived experience of nurses and nurse educators is that there is a lot of anxiety and test anxiety and stress as part of the nursing education process. It is well documented. And in my role as guidance counselor here at the Center for Nursing Studies, I see this every day. And I don't know about you folks, but I have noticed since COVID that we seem to have more anxiety and stress here at our campus. I think it has something to do with some of the changes that happened with the way high school was completed, with the way here in Newfoundland, there were changes to some of the exams that high school students completed before they applied and were selected to enter their nursing program. It sort of changed our lived experience so much in education. And so lots of nursing students feel less confident. And I don't know, Dr. Watkins, if that's your experience as well, feel less confidence than they did a number of years ago about their ability to succeed in a rigorous program like nursing.
Yeah, no question. And I think we've seen that right across many faculties as well within the university. There's no question about that. And it seems to have become more prominent. But one of the positive things is that we're talking about it more.
Right. And
we're more open to sharing how, some of those feelings of anxiety and what we can do to mitigate some of those.
Absolutely. And I think that's something that's going to be a theme as I talk this morning is accepting or acknowledging what is. Because when you try and push something away, and then you add more negative energy to it, and it becomes more difficult. So acknowledging what is and working with it can be a helpful strategy in all areas of our life. The third component that I'll look on is some strategies around preparing for the exam and some test-taking skills. So that's kind of how I thought this short session would go today. Next slide, please. So I've already talked about having a thorough understanding of what it is you're going to be tested on. That's very, very important. You need to know that. And of what the exam is going to look like, the process. Very important in order to prepare yourself to get the best out of yourself when you are actually sitting to write these exams. The second part of that assessment is assessing yourself. So based on what it is that you are expected to know, what are your areas of strength and weakness? Where are your gaps? And I mentioned earlier, I think the gaps are really, really important to address very early in the review process for exams, because this is where you're going to need to invest the most energy. Thinking about your learning style is important as well. And we have different learning preferences. I'm a very auditory learner. I used to love in nursing school to sit down in the lecture and sit back and listen to the discussion. And it really impacted me, and it landed in me, and it helped me to learn what I needed to learn in a big way. Some of you prefer a visual method of learning, so reading and seeing things. Others prefer a hands-on or a more tactile, kinesthetic learning style, actually doing things in the lab, in clinical, working with it in that way. And while you may have a preference, I would encourage you, as you are learning in nursing school and as you are preparing to demonstrate what you have learned on your exams, to utilize all of these modalities. Hear it, see it, actively work with it if you can. That will give you the deepest learning, and that will prepare you to be able to achieve more on the exams. And the other part of the self-assessment in terms of the knowledge and the skills that you're going to need to demonstrate, the competencies on exams, is looking at your study skills. Maybe you will need to tighten these up a bit. Maybe you're going to need to do some things differently. And we'll touch on some of that in this presentation today. But a really big part of what I want to talk about today, from a guidance counselor perspective, I'm very interested in the way you look at yourself. And I have a picture there of a cat that looks like Zeus looking in a mirror and seeing himself as a lion. Seeing himself, so Zeus, and this is what my perception of Zeus, and I think this is one of the reasons why he's so proficient at his competencies, is he only weighs 8 pounds, but he thinks that he is the king of the jungle. He thinks he is the most powerful being on the property. So he is very, very self-confident. And the way I look at myself and the way I think about myself has a big impact on my ability to get the best out of myself in exams, and on my ability to motivate myself to do what I need to do to move forward. So thinking about ways to really see yourself accurately. Because we often get caught up in an internal dialogue, which actually we start forming these beliefs about ourselves when we're very, very, very young. And we practice these thoughts and beliefs over and over again, and they become automatic thoughts. And so and this all happens probably before you're even 7 years of age. You have created sort of a dialogue in your mind of how you talk to yourself based on what you learned from the people around you who supported you, perhaps parents and teachers, and we need to be aware of this, because this is not necessarily accurate. So we need to consider these automatic thoughts when they come up. And so I invite you now, as you're thinking about yourselves, to look at yourselves with a wider lens, to notice your strengths and your weaknesses, to treat yourself as kindly as you would someone else, and to be really, really accurate but loving and gentle with yourself. This will help you to build your confidence. And the other thing I again point out here is, you all wanted to be nurses. Something brought you to this career path. What was that? I loved when I saw the poster that you created for this little presentation today. At the top of the poster, it says, "Go change the world." That really inspired me, because I think as nurses, most of us, and those of you who are preparing to be nurses, one of the things that brought us to this career path is we wanted to make a positive impact on the world around us. We wanted to be able to bring about positive change with our patients and clients and residents. And so it's really important, when you start to doubt yourself or you start to get down, to bring yourself back to that why, that purpose. What brought you here? Because that can help to create resilience and help to give you the boost that you need as you're moving forward now to get to these final exams. Next slide, please, Professor Sheila. So the second category was about anxiety. And as student nurses and nurses, you all know that stress is a part of our lives. It cannot be avoided. And as a matter of fact, stress can be very positive and powerful to support us. We call that eustress. So stress, we can use stress to our advantage. Stress is part of our survival mechanisms. It's what kept us alive, our ancestors. It is a mechanism that helps us to focus on what we need to do. And so stress management is something to think about, because stress can reach a level where it is no longer invigorating us and supporting us and helping us to really focus on those exam questions. I'll use me as an example. I always think about exams like a puzzle. And so you're going to think, oh, she's so silly. I love exams. I love writing exams, because I think about it as an it's like when I'm doing my puzzles and things, want to get the best out of it. And so it's a positive experience for me. Okay. So I use that excitement to help me to really focus on what it is that I'm trying to do. But I'm also very realistic. I'm aware, and I've seen this with nursing students, and I've seen it with clients and patients and residents. Stress can reach a point where it actually does overwhelm us. And then for nursing students and for students in general, then we can really have some issues with test anxiety. So as you're getting ready to prepare for these exams, I'm inviting you to keep an eye on yourself in terms of stress and to manage that stress. So when the demands on me outweigh my resources, then I'm going to go and, then I'm going to be more overwhelmed by the situation. And so I'll need to add some more resources or try and remove some of those demands if I can. I need to be aware of the signs and symptoms of stress for me. For me, when I'm really stressed, I don't sleep well. And Dr. Watkins and I have talked about this in the past. She'll say, can you do something late at night? And I'll say, sure, because I've got a lot on the go now, so I'm awake all night long. So I know when I can't sleep very well, that's the number one thing for me when I'm under stress. And so monitoring your signs and symptoms, monitoring the demands on you and the resources, and working with these things to help you to find the right balance in your life can be really helpful as you're preparing for your final exams. Next slide, please, Professor. So there is, as Dr. Watkins and Professor Sheila mentioned, there is a ton of evidence supporting that post-secondary education can be very stressful. Nursing education has been noted to be very stressful, and that there is a degree of anxiety that goes with this. And this anxiety not only affects our ability to motivate ourselves and to prepare for exams, it also can really impact us when we're writing exams. So test anxiety is a real thing. It's not a diagnosis per se, but it is part of the diagnosis of anxiety sometimes. So Quinn and Peters did a systematic review of the literature, and during that review, the two most effective strategies for test anxiety that they found for nursing students was using breathing techniques, particularly, of course, abdominal breathing, and working with progressive muscle relaxation. So I throw these out to you now because you can do these in the short term, but it's really, really helpful and effective to start working with these techniques before exams, and even to use these strategies before you start studying. So before you sit down to review something for your exam, taking a moment to notice your breathing. Feel the way breath enters and leaves your body. First, noticing what is, and then inviting that breath to be deeper, to be slower. Perhaps placing your hands on your abdomen or your belly and noticing your belly rise and fall. It sounds so basic, but it is so powerful at helping people to settle into the moment that they're in. In terms of progressive muscle relaxation and breathing techniques, there are all kinds of things. And I know you're using these with your clients, patients, and residents too. I have no doubt. when you go to administer an injection to your client, probably the first thing you say to them is, okay, take a big deep breath, blow it out. And so we're using these strategies with the folks that we're providing care for. We also need to give ourselves care, to direct this to ourselves. So progressive muscle relaxation, breathing techniques, there are many of these millions of things that you can access on the World Wide Web for practicing and for developing this for yourself. So I was going to ask you to list the strategies to decrease anxiety and to see what you come up with. But I think if there's, it looks like we have 38 people here now. Is that correct, Professor Sheila?
Yes, ma'am. We have
So I don't know if people want
a few students joining us from on YouTube.
Okay. I don't know, maybe take a moment and in the chat, and Professor Sheila, I'm leaving that to you to have a look at, or if you want to unmute your mic and bring something forward. There are literally, I'm sure, thousands of strategies to decrease anxiety. And I'm wondering what are some of the ones that you folks have found helpful? And so we'll take some deep breaths and settle into this moment while we're giving people a chance to process this and to respond. Music, beautiful. Music, actually, a lot of the studies on test anxiety and anxiety for nursing students identified music, especially classical music or music with a tempo or a beat that sort of matches about 60 beats per minute, have found that to be very, very helpful. Unfortunately, if you decide to write the NCLEX exam, you will not be allowed to have music. And here at our School of Nursing, we don't have music playing in the background. But as you're studying, yes, and as you are taking care of yourself, music can be an amazing, amazing strategy to reduce stress. Communicating to your near ones, yes. So using your support system, touching base with them, sharing with them, very powerful. That might be your loved ones, it may be your classmates, it might be professors at school, and maybe you have a guidance counselor or you have supports at your school that you can use. So yes, absolutely, very powerful. I just saw one and I lost it. I'm getting caught up in talking myself. Any other strategies that you folks have found to be helpful?
Don, for me, it's getting a really good night's rest the night before. I like to go to bed really early and make sure that I get a good night's rest. I have to go into an exam feeling rested. I could never be one of those that, as we used to call them, pull an all-nighter. I could never do that because that actually increased my anxiety if I felt that I had to stay up all night to study. So I had to get a good night's rest.
Absolutely. And, my experience with nursing students here at the Center for Nursing Studies is a lot of people really cram the night before and often stay up all night thinking that this is going to help them to do well in the exam. And of course, what happens is that's only good for working with short-term memory. That's only good for memorizing for a very short period of time some key points and facts. You need rest to be able to think critically and use good clinical judgment in exams, and to be able to really be in the exam and not get caught up in overwhelmment. So yeah, absolutely, a good night's sleep. Sleep in general is power for learning. The research on learning says that sleeping helps you to clear your brain of debris, but it also helps to make those synapses, those connections between neurons for deep learning. And somebody has raised their hand with a question.
Ma'am, I would like to introduce Dr. Ramu sir. He was a former dean of nursing in our RGHS in
Good
our
morning,
university.
sir.
So I would like to welcome you, sir.
Thank you, madam. Thank you so much. It's very good evening. Nice going. Really, it is very useful, more informative to our nursing students. Right time, I'm very thankful to Dr. Gajendra and team of RV College of Nursing. Really, I gone through Don and Dr. Kathy's really excellent talk. Excellent talk. Thank you so much. Sorry for disturbance. Sorry for interruption.
Thank you so much. It's lovely to meet you.
Thank you.
So maybe
Thank you for joining, sir.
Thank you.
So let's go to the next slide. And this is a busy slide, but so yesterday evening, I said, what are the things that really I have found that I recommend the most, and students have come back to me and said was the most helpful to decrease their anxiety as they're preparing for exams as well as they're writing exams. And I've already alluded to the fact that rather than try and ignore it or push it away, we really need to acknowledge it and to work with it. Mindfulness and meditation are well documented in the literature for helping to decrease anxiety. And many folks think that, so if you already have a meditation practice, that's amazing. Continue with that. Use that to support yourself, to be able to really get the best out of yourself in all situations in your personal and your career life, your world of nursing and on your exams in nursing. If you don't currently have a meditation practice, mindfulness is a form of meditation. It's about being in the moment now, just bringing your attention to this moment. So right now, if we were being mindful, we would just stop for a moment and drop into our experience. Maybe noticing our feet on the floor, noticing the floor supporting our feet. Again, bringing awareness to breath. Noticing what you feel, tactile, what you see, what you're hearing. Right now, mostly my voice. If there are any aromas or scents. So bringing your awareness to this moment. This is a very, very brief mindfulness technique, and it's very powerful for anxiety. It takes us away from the frightening thoughts into our head and brings us back into our bodies and into this moment now. I would recommend and that to make it less overwhelming, that people start maybe thinking about mindfulness as a practice, even that's just a couple of minutes every day. So spending a couple of minutes going through some of the things that I just talked about. Even just bringing awareness to breath. And you don't have to sit, and you don't have to assume a mudra. And you can really, really make, although meditation is amazing, this is an abbreviated strategy to help with anxiety. So as you're walking into the exam, notice the quality of the air around you. Notice your feet moving. Bringing awareness to the moment. And in the exam, when you have a moment, if you have moments of feeling overwhelmed, laying the pencil down or just closing your eyes for a moment and slowing down your breathing, noticing your feet, noticing the things, the senses around you, reminding yourself that you're prepared for this. You've done your best. Just taking that moment to bring yourself to your center, to bring yourself back into this moment now. It can be very, very powerful. And so this is mindfulness. These are also grounding techniques. I remember a couple of years ago for the NCLEX writing, the students who were writing all decided that they were going to wear red socks when they went into the exam, because we had talked about the root chakra, and we had talked about balance and grounding and connecting with the earth. And as a symbol of that, they decided that they would wear red socks, and that when they sat down to write the exam, they would settle in and ground in that moment and remind themselves that they had their red socks on. And if they became overwhelmed, they would come back to that again. And I heard back from those students, actually they sent me pictures and things, that was really, really helpful for them. So it's finding ways for you to be able to support yourself. And doing this, not just in the exam, but practicing it when you're studying, so that when you get into the exam, it will come more naturally for you. You will be more proficient at these things. And of course, the other strategies are things like self-care. We have to holistically prepare ourselves for nursing and for our exams. So we have to eat well. Dr. Watkins talked about how necessary sleep is. We have to have some downtime, some things that provide relaxation for us. It's often helpful to get out into nature. I like to walk around the back of my house and smell the trees and feel the air, feel the ground underneath me. Whatever your self-care strategies are. Being compassionate with yourself is important, and I've mentioned this already. All of these strategies and more, beginning to practice them now, today, as you review your exams. Keeping an eye on your attitude, your self-talk. When you start to talk negatively towards yourself, you can really decrease your confidence and increase your stress and anxiety. And this can have a negative impact on your performance. So I encourage you to remind yourself, you've accomplished a lot. You got through this year of your nursing students, or you've completed your nursing program. You've already done this. That's quite an accomplishment. So reminding yourself of this and setting an affirmation that you will succeed with your exam, that you will do well while you're writing these tests. This can be very powerful at supporting you. And since I brought my cat Zeus in today into the slides, I thought I would also mention that there is a lot of research around pet therapy. And here at the Center for Nursing Studies, before final exams, we actually have pets that come into the center so that students can spend some time with the pets before their exams, or the animals, the therapy animals before the exams. So for some folks, that can be very, very helpful. So this is a very old quote, but I love it. Whether you think you can or think you can't, you are right. This is a quote by Henry Ford. So it's important to see the good in yourself and set yourself up with those positive intentions, and to speak to yourself, I will succeed at that exam. Not I would like to succeed at the exam, I will succeed at that exam. So building your confidence, using this when you're preparing for exams and when you're in writing the exams. Next slide, please. An issue with preparing that I hear about all the time, and I'm an expert at this one myself. Dr. Watkins knows this very well about me, is procrastination. Sometimes we just put it off and put it off and put it off. And there's actually some neuroscience that can explain this to us. When I think about something that I don't think I'm going to be good at, or that I don't like, or that I'm overwhelmed by, the pain centers in my brain actually get activated. So I actually am feeling discomfort. So if I avoid it, that discomfort goes away initially. It's still going to come back and haunt me, isn't it? But initially, the discomfort will go away. But if I just sit with it, if I just step into what it needs to be done, actually, in about 5 minutes, the pain will start to go away. So this is something that I mention to nursing students when when we're looking at study skills and ways to learn and things like that. And so one of the techniques that I'm going to mention now shortly is called the Pomodoro technique. And that's a little tomato timer on the bottom of the screen. So this technique was designed by a psychologist who used a Pomodoro tomato, as a timer for setting a time limit for the tasks that needed to be completed. And so we're going to talk more about this in a minute. But procrastination is something I think that we all deal with. And sometimes you have to just put your bottom in the chair and get started. And know that it might not feel fun in the beginning, but if you get started, that discomfort will eventually go away. Oh, I hear some of your loved ones, your supports. Next slide, please. So preparing for your test. As I've mentioned before, know what the expectations of that test are. What is the test plan? What kinds of questions are you going to have? Think about that. That's really important so that you know what to expect. That will help you to fill in the gaps and to prepare yourself, but it also will help you not to be shocked and overwhelmed when you open up the test when you get into the room. Set up a schedule for studying. I know it sounds easy and I know we want to avoid it. I know that some of us want to procrastinate. So one of the things that I would encourage you to do is to sit down with your calendar and actually block out time that you are going to use to prepare for your exams. And pick those times according to, remember I said thinking about your learning style and your study schedule. So Dr. Watkins probably wouldn't want to do her studying at 11 o'clock in the night. She's an early morning person, right? I'm more of a late night person. That would be really good for me. It feels like I really can focus, at that time of the evening. So set your schedule up according to your life. I just heard someone had one of their family members, I think, with them. And so you may have childcare responsibilities, you may have a job, you may have lots of things in your life that you are responsible for. So finding a time in your schedule to set up blocks of review, study, and preparation time is important, and work with you have to work with what you have in your life, but if possible, set it up at the time when you are most alert, most able to absorb information. We already talked about the Pomodoro technique. For objective questions, it's really, really helpful to practice with questions. And for multiple choice objective questions, it's very powerful to use questions to practice with and to look at why an answer is right or wrong. Even when you get it right, still look at the rationales. And there are many of these that are available to you for many different topics in nursing. So these I find very powerful to help to prepare you for exams and also to decrease your anxiety. When you're studying something, don't just memorize it in the words from the textbook or the notes. Actually, say it in your own words. And it's really powerful if you teach it to someone else. Explain it to someone else. This I found when I was teaching, I learned more as a nurse educator than I ever did as a nursing student, because as I was preparing to help nursing students understand concepts, I really had to be able to explain it in my own words. That's very, very helpful. Another thing that's helpful I call it a cheat sheet with my students here at the center. And that's not encouraging you to prepare something to take into the exam to cheat with. I know you would never do that. But in your own words, when you're reviewing something, on one sheet of paper, writing down the main points. If only I could bring, this is what I would like to be able to bring into the exam with me. This is a powerful way of working with what I've learned to help me to really solidify it and to be able to access it in an exam setting. Next slide, please. So when you're writing the exam, depending on the type of test you will be writing, there are some skills that you can use, some test-taking skills. Next slide, please. So first of all, you really need to understand the question. What is this question asking you? Maybe it's a question about care of a client. What are the relevant facts about this client? What are the key words in this question? Rephrasing the question in my own words. And with a multiple choice, it's really important to anticipate an answer before I look at the potential options. Those of us who create exam items or questions, those options, we call one of them the right answer, and the others we call distractors. Sounds kind of sneaky, doesn't it? We're not meaning to be sneaky, but we want plausible wrong answers. So that's why we call them distractors. So what I find is if you look at all those potential answers before you get your head straight on what the answer, the correct or best answer is, you will be distracted by them. So first, see what comes up for you in your own head or in your gut even. And then if it's a multiple response or multiple choice, treat them each as a true or false. Is this true or false? Choosing the best option or options. Sometimes we have select all that apply options. Next slide, please. So when you're in the exam room, I think you must be tired of hearing me talk about breathing, and you must be thinking, wow, I thought she was a nurse. If we weren't breathing, we wouldn't be alive. I want to remind you, as you study, as you sit for the exam, that you take a few moments to bring attention to breath, that you really bring yourself, body, mind, and soul, through focusing on breath, into the situation that you are in, to be present, to step into the circumstances that you are in. Remember, when you're looking at nursing questions, in nursing, we use the nursing process. So we assess, analyze, plan, implement, and evaluate. Make sure that you have followed that sequence when you are creating options for your client, when you are picking the best strategy, when you are coming up with a plan of care. We also remind nursing students, Dr. Watkins and I, over and over again, remember Maslow's hierarchy of needs. When you are selecting options for your clients, make sure that those basic needs, the need for oxygen, the need for nutrition, the need for safety, that we meet those before we focus on the other needs. And so we talk about in nursing the ABCs: airway, breathing, circulation. Those are the basic needs. Think about therapeutic communication and the most effective way of communicating with your clients. That can be part of a question in a nursing exam. Be very careful not to read into the questions, not to add things to it, because it's human nature to do that. So remember, I said, read the question, think about what you're being asked. Don't add anything to it. Stick with exactly what you are being asked so that you don't get distracted. Next slide, please. So we're winding down now in this session. I thought I was only going to have a 10-minute talk with you. I guess this has been a little more than 10 minutes. But here's some things to start doing now. Create a study schedule. I've already mentioned this. Organize it. Plan your schedule with your particular circumstances in mind. Focus when you are studying. Divide the actual study segments With Pomodoro technique, they recommend 25 minutes of focused, concentrated study, actually setting a timer for 25 minutes and focusing on on the objective or whatever the intention is that you have set for yourself for this segment of study. After the timer goes off, take a break for 5 minutes. Get a cup of tea, move around, go be with your pets, do whatever you need to do to energize yourself, and then come back for another 25-minute segment of study and review. This is supported in the research for learning and memory. This will help you to be able to get the most out of your study time. So perhaps you will have 4 25-minute segments with 5-minute breaks in between, and then reward yourself. Maybe watch something on Netflix, go for a walk, have a nice meal, whatever would be rewarding for you. It's important to reward yourself so that you stay on track. Plan activities to support yourself holistically, and we've already talked about that. You must care for yourself, body, mind, and spirit. Next slide. I'm going to say this, but I know you're going to do it. Don't stay up all night cramming before the exam. It will not help you. Do something relaxing before you go to bed prior to the exam. As Dr. Watkins mentioned, get to bed early. Sleep is very helpful at memory consolidation, and it will help you to think critically and process in the exam. Set your intention as you're going to sleep as I enjoy exams, so I would say to myself, you're going to really have a great time in that exam tomorrow. I would do some deep breathing and let myself go off to sleep, but set your intention to be successful. Next slide. On the day of the exam, eat, monitor your self-talk. When you get to the exam room, if you're feeling, or outside the exam room, if you're feeling really anxious, write down all those anxious feelings. Get them out of you, express them, crumple them up, and throw them in the garbage. Let them go. Take some deep breaths and begin your exam. Next slide. We've been using the nursing process for all of this: assessment, analysis, planning, implementation, and evaluation. Next slide, please. So here is Zeus saying goodbye to us. He's having a cat nap, one of the most effective stress management strategies. He's been such a teacher for me. I'm reminding you with his cat nap here today to be gentle with yourself. Do set up those schedules. Get started now. Take care of yourself. Sharpen your claws by doing your review and your study. Make sure that you do all the things to take good care of yourself, but also make sure that you sleep well, have a nap, have some fun. And the following slides that we won't go through now are there for you if you are interested in NCLEX preparation specifically. So I think I've gone 3 minutes over, Professor Sheila.
Not an issue, ma'am. We love to hear from you. And I know definitely many would have fallen in love with zoos also. Thank you so much, ma'am. We have learned a lot, especially not only the students. As teachers, we too need to know how to manage the stress and to teach the students how to manage the stress during the exams. And your CAT model test to success is definitely going to be very useful. And also, I believe that the students will use the Pomodoro technique as well and stop from procrastinating things. And thank you so much, ma'am, for sparing your early morning with us. And I hope your day is going to be a very fruitful one. And we look forward to collaborate with you for in future as well.
Thank you.
Thank you, ma'am.
It's amazing to get to see your faces and be here with you this morning.
Thank you much, ma'am. I thank Dr. Katie also and Madam Lily as well for helping us to coordinate with you, ma'am.
Thank you, Mrs. Sheila. Good morning, everyone. Dawn, I haven't met you yet, but good morning, Dr. Kathy.
Morning.
Good morning. My name is Lily Silverage. I'm one of the Immigration Program Development Officers with the Government of Newfoundland and Labrador. So it's very nice to be with you all, and very nice to see Mrs. Sheila again. Don, so when we were in India, our team and I, we met Mrs. Sheila and her, faculty in Karnataka, India. So it's very nice to have this collaboration again. And you did a fantastic job. And I was just listening. And thank you so much, RV College, for inviting us. And thank you to Kathy Watkins and Don for, definitely willing to take this opportunity to bring your wisdom to the students in India. Yeah. And definitely we'll do if RV College needs more of this, definitely we can arrange this as well. Kathy, do you want to say anything?
Sure. Hello again, everyone. First of all, a huge thank you to Dawn. I know that she's put a lot of work into this, and Dawn is, I would say, our most valued resource at the Center for Nursing Studies. Absolutely. And the way that the students speak about her and react to her and respond to her, it's just nothing short of awesome and amazing. So, Dawn, thank you. I know the students and the faculty here and all our guests who have joined have taken a lot from this morning and be able to apply it to their exams as they write them. And I understand the exams are very soon. Is that correct, Professor Sheila?
Yes,
in a few days.
They are taking it up day after tomorrow.
Okay, after tomorrow. So yes, so very, very important. And for me, I've been writing exam items for many years, mostly multiple choice questions, because that's what our exams in Newfoundland and Labrador and our registration exams in Canada have mainly been. For a very short period of time in the mid 2000s, we did have some short answer questions on our national licensure exam, but then very quickly moved away from that again after about 2 years. So all of my expertise lies in writing multiple choice questions. And after many years of writing them, you get very good at answering them, even when you don't know the content, because you just become very savvy with how to respond to a multiple choice question. So we'd be happy to share some of that expertise with you down the road if you'd like that as well with your faculty. We'd be happy to do that. So thank you to Don. Thank you to all of you for joining us. We know it's getting later in the day in India, but we really look forward to continued collaborations with India, and enjoy the rest of your evening.
Thank you so much, ma'am. Thanks to Dr. Ramu also for joining with us, sir, and for supporting us. And I also thank our beloved principal, Dr. S.R. Gajendra Singh, who has been a constant support and encouraging us to conduct such webinars. I thank you also, sir. A very good day to all who have joined from Canada, and a very good evening, pleasant evening to all in India.
I'm watching this video along with my daughter, who is studying engineering. So your talk is excellent, madam. Not only for the nursing students, even for the engineering student. My daughter is sitting next to me. She is very happy with your talks. Thank you so much. Really more informative. Definitely more informative. Thank you. Namaste.
So yes, go change the world.
Yeah.
That's our tagline, ma'am. That's your
tagline. Yes. Believe in yourself. Go change the world. You can do this.
Yeah.
Thank you, ma'am.
Thank you.
Thank you, Anil. Thank you.
Bye-bye.
Bye-bye.
Bye.
Bye.
Bye.